So compression socks can help your leg symptoms, but they don't fix what most people think they fix. And this is where some people still get confused. Hi, my name is Dr. Jarrod. I'm a vascular surgeon here in Cary, North Carolina. And today I want to explain what compression socks do, what they don't do, and when they're helpful. So why do people wear compression socks? Well, it's pretty simple. So compression socks are one of the first things that we all do if we start having leg symptoms. Our legs start feeling heavy, swollen, achy, tired by the end of the day. And for many people, compression stockings, they do make your legs feel better. That relief is real, but it's important to understand why. So what do compression socks actually do? So all compression socks do is they apply pressure to your legs, which helps reduce the fluid buildup and supports the venous circulation out of your legs back up to your heart. But not all compression socks are the same, and this is an important distinction. There's a difference between just regular compression socks and graduated compression socks, or you'll see graduated stockings. So simply put, compression socks, normal compression socks, they apply pressure uniformly, starting from around your ankle all the way up to below your knee if you're wearing knee-high compression socks. But the pressure is uniform. Graduated compression stockings, they apply pressure where you need it most if you have chronic venous insufficiency or some other diseases like lymphedema. The pressure buildup in chronic venous insufficiency and lymphedema is mostly right around the ankle, just above your ankle joint. So graduated compression stockings were designed to apply pressure where you need it most, right in that spot. And so that's why they're the better stockings when it comes to people with chronic venous insufficiency or lymphedema. So you may be thinking, well, I'm wearing compression stockings for my leg swelling. Why do the symptoms come back when I take the stockings off? Well, remember, compression stockings or compression socks, they are for symptom management. They don't get to the root cause, right? So it doesn't matter what's causing your swelling, you wear compression stockings. 9 times out of 10, they help your symptoms, but your symptoms come back because you haven't treated the cause. And when it comes to chronic venous insufficiency, as long as you still have as long as you have that problem, compression stockings may help, but it is only temporary. For some people, compression is enough, especially if symptoms are mild, it's occasional, it's related to travel, long days, standing, maybe a certain work day you're standing longer than normal, you have a little bit of swelling, compression stockings are great for that. But needing compression every day is a signal. It usually means there's an underlying venous circulation issue. So compression stockings work best when you put them on in the morning, take them off at the end of the day, especially if it's a day where you're going to be on your feet most of the day, where you're going to be sitting a lot. And you take them off at night before you go to bed. You know, when you're going to bed, of course, you're laying flat, so you don't really need compression stockings to augment the venous circulation. Also, as a side note, if you're going to be traveling for more than 2 hours, you're going to be sitting in the same position, then you should really wear compression socks. Knee high is fine. It helps prevent DVT or deep vein thromboses or clots forming in your veins. So it's really important to wear it thin. And if you can, say you're in a car traveling for more than 2 hours, it's really great if you can stop every hour or so, get up, walking around, keep your vein circulation going. It really helps prevent DVTs or deep vein thromboses. So what should you expect when you wear them? So you probably already know stockings aren't pretty, so expect that. They look ugly, like some your grandma may wear. But you may find some online that you like. Some of my nurses here have some floral patterns. I mean, find whatever you like, whatever works. The most important thing is that you're wearing them. And also, starting compression stockings, you gotta get used to that tug and that constant pressure in your legs. Compression stockings, especially specifically graduated compression stockings, they come in different amounts of pressure. What you really want for leg swelling is you want that medium grade pressure, which is 20 to 30 millimeters of mercury, or you'll see on the compression stockings 20 to 30 mm space Hg. It just means that there's a medium amount of pressure, but if that is too much, if it makes your legs too tender, especially by the end of the day, start with the lower pressure ones, which tend to be about 10 to 15 millimeters of mercury, and start there, because This is a really important point to make here. Wearing any compression is better than no compression, because if you wear no compression, vein disease tends to progress faster, and your symptoms get worse faster. And really, it's really important to start wearing something. So if the only thing you can wear is the low pressure compression stockings, start there. Compression socks should feel snug. That's normal. They shouldn't be painful, and they shouldn't cause numbness. If that's happening, then the stockings are probably too small for you. You should get remeasured. We can measure your legs here, or you can measure it at specialized stores, especially medical supply stores. You should really get measured. You should not wear stockings if they're causing numbness or causing that much pain. And it usually takes a few days to get used to them, putting them on. But again, if it's hurting that much, take them off. All right, if you're in the Cary area and you're relying on compression socks daily just to feel normal, then it's worth getting checked out. We do a simple ultrasound here. We can tell you if it's your veins causing a leg swelling, if your veins are functioning properly. And it's important to remember, compression gives relief, but clarity gives control. All right, thanks everybody. Thanks for listening, and I hope to see you soon. Everybody take care.